The full-scale war that started on February 24, 2022, did not stop the operations of non-government organizations in Ukraine. Their staff, while facing the danger daily, continue working to provide services to people with tuberculosis and other socially dangerous diseases.
On the
24th of February, the shelling started at 5 a.m. and street fighting began. We were not prepared to these challenges, but every day we went to work despite the situation.
Nurses during shelling made runs to the offices for a short time, and our social workers already were waiting there.
A humanitarian convoy was coming to us. There were 5 buses. They were hit with mortar fire and the volunteers perished. On August 11th, a missile hit my home, so now I live here. Few people here live at home. We mostly live in bomb shelters.
You know what it's like in Donetsk Oblast now. There are daily shellings almost everywhere. But we must thank our volunteers who continue every day of every month delivering the medicines to our DOT providers, and the DOT providers deliver them to our clients.
I believe we are doing our best right now, and even a bit more, probably.
100% Life Network in Kharkiv provides social services to HIV-positive people and people with tuberculosis. Kharkiv is the second largest city in Ukraine, just 30 kilometers away from the Russian border. So the city immediately became the focus of hostilities.
In the first 2 days, they heavily shelled all the city districts. We were all desperate and did not know what to do, but we had to organize somehow. The first thing our clients and social workers called me about was where they could get ART and TB medicines. Dispensing the drugs was the hardest thing to do. Nurses, during shelling, made runs to the offices for a short time, and our social workers already were waiting there. They would put the medicines in a backpack. There was no public transport. Everything stopped in the city. And my heroic boys drove on icy roads in that February. One of them rode an electric scooter. He could do up to 120 kilometers a day. I also have a manager who transported big backpacks himself. He forbid making posts about him on the social media. No information. He believed it was his personal contribution to the fight. Our region still remains unstable. Today, we have had 3 air raid alarms and 2 hits. The oblast is being shelled all the time. There is the problem of security and the problem of ensuring uninterrupted treatment. We take all possible measures to deal with these problems. Continuity means clients need to receive our services without interruptions. This is done through flexible approach, offline and online.
Donetsk Oblast, chapter of the Ukrainian Red Cross Society, implements Bright Life without tuberculosis project in the east of Ukraine. In 2022, the part of the region under occupation increased significantly. The rest of the area became a fighting zone. All the offices of the organizations were either ruined or damaged.
We understood we had to act quickly. Our people must not lose access to the medicines. So we decided to dispense to our clients a stock of tuberculosis medicines for 30 days or more. Delivery of these drugs is very difficult because of the situation in Donetsk Oblast. There are daily shellings almost everywhere. But thanks to our volunteers, especially our Kramatorsk chapter, the drugs are getting delivered with without interruptions. Every day, they deliver the drugs to our clients, and DRT providers dispense them to the patients. For example, in areas with low level of tuberculosis detection. We understand that such areas are growing, but the tuberculosis service has almost stopped working. Medical institutions in the most dangerous towns are being closed. People leave these areas, and that is a big problem. I am truly thankful to our employees who have stayed in Donetsk Oblast. They are 2 case managers, interregional coordinator, and DOT providers. They have stayed, and they keep in touch with our clients. And it gives our clients hope about their future and successful treatment. Psychological condition of our clients is very important for the treatment outcome. In 2023, Larisa Fedorivna Kisil, a DOT provider from Donetsk, received the highest award of the International Red Cross, Florence Nightingale Medal. This medal is awarded to people taking care of wounded and ill in the times of peace and in the times of war. The town of Donetsk has also been heavily damaged. 2/3 of the buildings are ruined, and houses burn every day. Yet she continues taking care of her clients. She has deserved this award.
Chernihiv Network has been operating for 20 years. It is a patient organization aiming to improve the quality of life of HIV-positive people and people with tuberculosis. The organization works in the city of Chernihiv and Chernihiv Oblast. This region became the fighting zone on the very first day of the war. The city itself was encircled by the enemy.
In the first 3 or 4 days, we tried to stay in shelters, as we did not understand what was going on and what we were to do. The main goal was to ensure uninterrupted treatment. And all these stories are about that. We shared our phones, several of them, for the hotline. The clients would call me, tell me where they were from, which area. Then I would link them with the closest social worker who would deliver the medicines. The military and the police helped us move around the city. Emergency responders delivered the drugs not just in the city, but in the oblast too. And as the city was encircled, it was a problem to deliver the medicines from Chernihiv to patients in remote areas. It was very difficult, or even impossible. At some points we had to bring medicines for kids by boat, because the bridges in the city were destroyed. And the scariest day for us was probably on March 30th, when a humanitarian convoy was coming to us. There were 5 buses. They were hit by mortar fire and our volunteers perished. The city immediately united. Many people volunteered to help, like delivering food or water to different areas. They delivered our medicines as well. What challenges do we have now? For a month and a half, almost 2 months, March and April, Chernihiv Oblast was under occupation. And we see how much it has affected people. They do not plan for the future. They have very limited vision of the future. We have significantly increased our efforts to form adherence to treatment. Many people ask, why should I care? Generally, the situation with the spread of the diseases and case finding has got worse. Infected people are found at later stages.
Nikopol is located on the bank of the Kakhovka reservoir that basically disappeared after the destruction of the dam. The town lost its water supply. On the opposite bank of the Dnipro, there is Zaporizhzhia nuclear power plant. That is where the town is being shelled from daily. In these difficult circumstances, charitable foundation Resources of Life continues providing services to patients with tuberculosis.
How has our life changed? We get bombed often, basically every day. We run between bomb shelters. More people now need medical and social support because there are more people with tuberculosis now. People live in bomb shelters. We spend our nights there most of the time. Very few people stay at home. We mostly live in bomb shelters. And on August 11th, a missile hit my house. The first section is completely destroyed. So now I live here. In the morning, I go to work. And in the evening, I live here, together with the people. We are all like that here. I can show if you want. This is my room. Look, this is where I live. Here, the room, see? Another social worker lives here. That is how we live. Almost a year now. We have already got used to it. Well, how can we leave the city? My son lives in Germany. And right after the war started, he told me, "Mum, move over here." But how can I leave these people? I know them. They know me. When the war started, our clients began asking us, what is going to happen now? Where should we go? What about us? And so, these are people who need help. And if we leave, what will they do? I really don't know.
Charitable Foundation, Everything is Possible, provides services to people with tuberculosis in Zaporizhzhia Oblast. Before the war, the organization was based in the town of Melitopol, which was occupied by the Russian army in February 2022.
On the 24th of February, the shelling started at 5 a.m. and street fighting began. We were not prepared to these challenges, but every day we went to work despite the situation. And every call we received was like an important mission. There was no transport communication between towns. We could not deliver the medicines to the people. There were many roadblocks. The men were stopped there. Their cars were searched. There were more than 30 roadblocks between Zaporizhzhia and Melitopol. And you could not use a truck to deliver humanitarian aid, including our medicines. At every roadblock, you had to unload the cargo and load it back again. So we used small cars. Some of our employees had to leave. And we changed the registration address to Zaporizhzhia city. Some of our employees continue working on the occupied territories. And there are clients in Melitopol we provide counseling to. If the screening is positive, we refer them to tuberculosis dispensary. Because people there cannot receive medical care elsewhere. We send the medications. They get treated with Russian drugs there. Those are of a poor quality. Their tablets and pills are of irregular form. And if they shaken in the box, they just crumble. Also, those medicines have strong side effects, but there is no choice. We refer people. We do not have an access to the site where the care is provided. Because there are checkpoints around the dispensary, you cannot get inside. A unique thing we did is working with postmen. They help us. They know everything about everyone. Who needs what kind of help and where? They called us, we went there and provided help to the people. For me, my colleagues, they are all heroes. Heroes on the humanitarian front line.
Mykolaiv Oblast chapter of the Ukrainian Red Cross Society provides social, medical and psychological services to people in the region and to internally displaced persons, including people with tuberculosis. The beginning of the full-scale war became a challenge for the organization, as most of the oblast around the city became a war zone.
The situation was very difficult. At the beginning of the war, there was heavy fighting near the oblast capital. Some territory was lost, temporarily occupied. Unfortunately, we lost contact with some of the clients who had been receiving outpatient treatment and stayed in the occupied areas. The clients who lived under constant shelling required special attention because they were emotionally shattered. Our DOT providers played a special role back then. They continued delivering the medicines to the patients. They worked as usual. As transport connection became a problem, we had to look for other means of movement. We used additional transport from volunteers, we used other vehicles. In particular, we used bicycles the Alliance for Public Health provided for this purpose. The Mykolaiv Oblast chapter was the first non-government organization to enter the de-occupied territories. We had something like 5 clients we had lost contact with since the occupation began. We recovered 3 out of the 5. One decisively refused to leave because of his severe health condition. The other 2 we brought here, and they got examined on the same day. They renewed the treatment and completed it successfully. I think this is a great achievement. The challenges we face are the deficit of medical personnel at healthcare facilities, providing care and treatment to patients with tuberculosis. Also problems that we had before the war with the implementation of the health reform. Another thing affecting effective support of the clients is that they keep migrating all the time. However, considering the situation, we are doing good. We have the main thing, tolerant and humane attitude to all our clients. We try to encourage our staff to incentivize them to do a good job. I believe we are doing our best right now, and even a bit more probably.
We have shown you just a few stories of unbreakable Ukrainian non-government organizations, but this work continues being done by thousands of heroic people all around Ukraine, every day. We do the screening in bomb shelters, we work in the streets wearing armor vests, we ride bicycles on our ruined roads to deliver the medicines and use post for its deliveries to the most remote areas. We have stood our ground and not yielded to the enemy and the disease. We continue our struggle, unbreakable against tuberculosis.